And good morning, I'm Dr. Deuk at the Deuk Spine Institute. I'm here with one of my patients who presented with a Piriformis syndrome. It's one of the most painful conditions in the world. It's a contributor to lower back pain. The pain is actually located in the lower back, right in the top of the butt cheek. And there's a right piriformis muscle and a left. And what happens is a patient will be bending over with improper posture, and they will tear that muscle deep in the buttock. And once the muscle's torn, it just does not repair or heal itself properly. So what happens is there's a weak point, and you can repeatedly aggravate it by simple movements like twisting or bending or just bicycle riding or golfing. And every time the muscle gets aggravated, it flares up and causes horrible pain. The treatments vary from injections to medications and therapy, but none of them work. None of them actually give permanent pain relief. The only treatment that we found that works permanently to get rid of piriformis pain is to go in and do a minimally invasive piriformis muscle release, where I make a 4mm incision in the skin in the lower back, and I go in with a wand and I basically cut through scar tissue that's holding the muscle in tension and allows the muscle to relax. All right, you had this procedure done, and this was done how long ago?
Couple of months.
Couple of months ago. People are always asking, Dr. Deuk, show us a patient that isn't right after surgery, but several months ago. So you had this several months ago. How are you feeling today?
Much better. My activity level has improved. I'm exercising every day, pushing myself more each day, able to just enjoy things I wasn't able to do before.
And do you still have the pain in the buttock, or do we get rid of that?
Got rid of that. It was like sitting on a golf ball forever.
And it's gone?
And it's gone.
Awesome. Are you happy with your choice to come to Deuk Spine Institute?
Absolutely. I was referred by a doctor who had seen you at a conference and discussed your procedures, and thank God I called.
Well, I guess it's a good thing I go to conferences and give talks, isn't it?
Yes, it is.
Very happy that you're doing well. We did your piriformis release over 2 months ago, and that piriformis pain is now permanently gone. Anything else you want to say to your fans out there?
Just thankful that I was referred and found your clinic.
All right, well, get out of here, go enjoy life, do all the things you like to do. All right.
Thank you.
Thank you.